All right. Hi, Kathleen. How are you doing today?
Good, thank you.
Your vitals were a little elevated today. Your blood pressure was 140 over 80. Your pulse was 140. Your respirations were 22. Anything going on?
No, I mean, just a little bit of traffic, but usually I have like a morning drink and I didn't this morning, so.
So it could just be from like anxiety, you're stressed
Yeah,
out.
just a little stress.
Okay. Do you drink every day?
Yeah, pretty much.
Okay, so you haven't had a drink this morning. Has that been an issue lately?
Yeah, more than normal. I just got a new job, so I'm stressing out a little bit more.
About how much do you drink a day?
Kind of just like sip on it within like the couple of days, like 1 to 2 days, usually about a bottle I'll finish.
Oh, okay. And then do you do anything else other than drinking?
I deal with a little bit of substance abuse, yes.
Okay, would you like us to like give you some resources to stop, or are you willing to stop?
I'll consider it.
Okay, because like a lot of things can happen with drug and alcohol abuse. Would you say that you're abusing it, you think?
Yeah, I'd probably say I'm abusing it.
Okay, so as you know, alcohol and drug abuse can impact your overall health, including within your mouth.
Mm-hmm.
It can cause periodontal disease, and then you need an SRP to get the bacteria out because it can lower your immune system and get all the bad bacteria in there. And that can also cause dental cavities and even cancer. So at the end of the appointment, I can go ahead and give you some helplines to help you quit, even if you're willing to.
Sure.
All right, and then so after doing your assessments, I noticed that you have some deeper pockets, so which does indicate periodontal disease. So that just means that the bad bacteria has gotten through your gums and has taken away bone. I can do non-surgical treatment initially. So I'm just gonna do a scaling and root planing, which is deep cleaning, just gonna get all the bad bacteria out, and I'll irrigate. And then I can also give you some antibiotics. The dentist can prescribe that for you. And if it's too bad, we can even go into surgical treatment that the dentist will perform.
Hi Kathleen, how are you doing today?
Hi, good.
I'm Isabel, I'm one of the hygienists here. I'm just gonna be talking to you about how taking alcohol and drugs can affect your oral health and cause cavities and stuff like that. So I have a couple questions I'm gonna ask you first just to see, kind of get an idea of your condition. Do you know if you've experienced any cavities in the past?
Yeah, definitely.
Definitely. With those cavities, have you experienced toothaches or any pain in your mouth?
Here and there. Sometimes I've noticed some swelling around like my cheek area. But yeah, definitely some pain.
Okay. And another question, how often do you drink and take drugs? Is it every day, every
Probably
once in a while?
daily occurrence, yeah.
Okay. And then when you drink and take drugs, do you do that at the same time or is it separate times without?
Kind of back and forth. I'll like alternate.
Okay. Sounds good. Okay, so I have some information for you here. It just explains how drinking and taking drugs can lead to those cavities. Just gonna read off for you. So frequently drinking alcohol and taking harsh drugs often leads to the rapid decay of tooth enamel, ultimately causing cavities. Alcoholic mixes usually are very high in sugar content, which is not good for the teeth because sugar helps trap harmful bacteria in the mouth. Other alcoholic beverages, such as beer, wines, and other strong liquors, might not be as high in sugar content, but they're still extremely acidic. These acidic substances lead to the erosion and breakdown of enamel. Since teeth are bones, they cannot be naturally rebuilt or regrown once they are damaged. So once that protective layer of the enamel is gone, it exposes the beneath layers of dentin or pulp, which both contain nerves that causes sensitivity or even the harsh pain. So harsh drugs work similar to alcohol by causing the erosion of enamel. These chemicals contained in the drugs cause a very rapid decay of the teeth, once again, which causes extreme sensitivity and painful toothaches. So it's very important for you to limit the intake of alcohol and completely expel the use of drugs to protect the health of your teeth and prevent tooth decay.
Kathleen, how
Hello.
are you?
Good, how are you?
Good. I'm another dental hygienist is going to be talking to you today. I'm going to be talking to you about cancer. The initial dental hygienist told you about the periodontal disease, cavities, and cancer, which can be a result of drug and alcohol consumption. So first, I want to start off by telling you that alcohol and drugs by themselves, they do cause great damage, but when you combine them, the damage can be even further. So we're gonna look at this pamphlet here.
Okay.
So I'm gonna go ahead and let you know that heavy drinking can cause many types of cancer, such as stomach cancer, liver cancer, cancer in the oral cavity, the esophagus, throat, and even breast cancer in women, amongst others. Was this something that you knew?
Not really, no. I didn't realize.
Right. Yeah, no, breast cancer can be very common in drug users. Also, drug use can cause many health problems such as cardiovascular disease, stroke, seizure, AIDS, HIV, lung cancer, liver disease, or mental disorders. Do you feel like you've experienced any of the following?
No, not yet.
No, good. Now, also, high alcohol, hold on, pause this one. Okay, so alcohol and drug consumption can have adverse effects inside of your mouth. High alcohol consumption can cause low salivary production, which eventually does lead to dry mouth, and can cause high plaque buildup, and which eventually can also cause cavities in the long run, along with gum disease. High drug consumption can cause dry mouth as well, and tooth erosion, which eventually leads to tooth decay and gum disease. Now, a combination of alcohol and drugs, including tobacco intake, are high risk for oral cancer. And ways that you can go ahead and prevent everything that I have stated are, of course, by the cessation of drugs and alcohol. If you cannot do it all at once, even if you slowly start decreasing the intake, that would definitely be helping you. Regular dental visits and good nutrition. Nutrition does have a lot of influence on your situation. Now, you can prevent alcohol-induced cancer as recommended by the CDC by limiting intake of 1 drink or less in women and 2 or less in men. And you can prevent drug-induced cancer by not using drugs, eating healthy, and getting regular medical care.
Okay.
Do you have any questions about anything that I stated?
No, not really.
Okay, good. Okay, Kathleen, so we want to go ahead and talk to you about treatment for your drug and alcohol addiction.
Okay.
Is this something, as you stated, this is something that you're interested in, correct?
Yeah, I think so.
Okay. Are you willing to make lifestyle modifications?
I want to believe I can, yeah.
Yes. Now, do you feel like you want to start now? Do you want to start in a month? Do you want to start in a couple of weeks? Is this something that you really want to do already?
I think so, but I think it also depends on the day. But today I feel like I really need to stop now.
Okay, good. So now, do you feel like you can go ahead and start by yourself, or do you think that you're going to be needing help from other resources?
I think I want to try to be able to stop on my own and then maybe need help in the near future.
Okay, great. Okay, so we suggest that initially you contact a helpline.
Okay.
This will be your first step. They can go ahead and talk to you, and then from there you see if you need a little bit more help. If you do, you can go ahead and go to your physician. They could potentially prescribe some medications that can help you suppress that craving and eventually lead on to better health. Also, with that, of course, you have to decrease the intake. You have to try to keep yourself busy. Anything that keeps you energetic, go for a run, go out with some friends, some family. Just go ahead and make a few lifestyle modifications so you don't feel the need to consume drugs, consume alcohol.
So we also have other information, pamphlets that explain different support groups for alcohol and drug abuse. We're going to give that to you when you leave. It also includes the hotlines you can call.
Okay.
But other than that, we want you to know that we're always here for your support too. If you would like, we can make short-term or long-term goals.
We're going to be keeping up with you, not just at your regular dental visits, but every couple of weeks, we're going to give you a call. You can tell us how you're doing. If you're going to be needing further help, we're going to be able to assist you as well. If you feel like something is not working, or if you're leaning on the wrong direction, we can go ahead and redirect you and see what else can work for you. We are here to help you. Of course, it's not going to be an easy journey, but we're going to lead you and we're going to be working with you in order to better your health.
Thank you. I really appreciate it.
Of course. Now, do you have any questions, or how would you like to start? You just want to start with the helpline and then
Yeah, I think the
go on from
helpline
there?
probably first. Yeah.
Okay, perfect. Well, thank you so much for coming in today.
Thank you.
We hope to continue working with you in this journey.
And of course, don't hesitate to contact us, call us if you need anything.
Okay, thank you.
Of course.